249 new COVID-19 cases were confirmed today, taking Singapore's total to over 46,800. They include 16 community cases, all of whom are work pass holders, and 4 were close contacts of earlier cases and already in quarantine.
There was also 5 imported cases reported today who had been placed on stay-home notices upon arrival in Singapore. Now, more details will be announced tonight. In other COVID-19 developments, Hong Kong has brought in tougher social distancing rules to fight a spike of new infections, and a vaccine developed by US company Moderna is showing promising early results.
Let's discuss all of this and more with Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back, Professor Teo. Now, infections in the foreign worker dormitories have been hovering between 100 and 200 new cases daily since the end of June, but rose to the 300s recently. So, while the numbers in the dorms aren't as high as the peak in April, they haven't fallen by as much as some, including yourself, had expected. Why is that, though?
As much as I hope my previous prediction of 3 to 4 weeks in late May for the dorm situation to stabilize a lot more would come true, I'm very sorry that it didn't happen. And in fact, it will take a while longer for the dormitory situation to fully clear. And this is certainly something that many of us underestimated, that as we learn more and more about how the coronavirus is transmitted, we start to realize the implication to high density settings such as the migrant worker dormitories. 2 aspects I will talk about. Firstly, the number of foreign workers living in the dormitories, we know that is very high. And it is clear now that there are hidden reservoirs of infections that can happen within the community as well as in the dormitories. And especially when we know asymptomatic infections can potentially happen. While the majority of the dormitories have been isolated, the spread can continue within the dormitory if there are infected foreign workers who are asymptomatic or who are very mildly symptomatic. The second reason is that it comes back to the definition of the households. We know that the coronavirus is highly transmissible within a household unit. In the usual households in the community, we usually have between 3 to 6 members in each household. And we know that if one member of the household is infected, it is almost certain there will be other members in the same household that will be infected. In the dormitory, each room houses between 10 to 20 residents. And initially, we anticipate the spread will happen within the room to the residents within the same room. But because there are shared facilities as well, such as toilets, showers, wash basins, we know that such high touch points have been shown to contain potentially high viral load. So the definition of the household in a dormitory can now actually be an entire floor level, which may have 10 or more rooms. So coupled with the very recent evidence that the virus could be airborne, and now you imagine a household unit not with 3 to 6 members, but potentially 100 to 200 members. And this is really the reason why the spread in the dormitories is going to take a while longer to contain and to clear.
Given the new wave of cases in countries like Hong Kong and also even in Australia, what lessons should Singapore draw from that?
I think let's firstly recap what is happening around the world that it's worrying. We have Japan, Tokyo now reinstating its highest alert level, reimposing quite a lot of its restriction, particularly around clubs and workplaces. Hong Kong similarly reimposing restrictions, closing down Hong Kong Disneyland, gyms, bars, restaurants. Bank and civil service people are reminded that if they can work from home, please do so. Australia, Victoria State undergoing a 6-week lockdown. So I think this is exactly the situation that many countries in the world, even those with very good public health measures and systems, but yet we see that there will be this occasional recurrence of spread, and that's where you could see there will be a repeated closures that will be necessary. And this really reminds us that there is still an outbreak out there. And Singapore is still in a state of DORSCON orange. It is still happening. The spread is happening within Singapore. So what is happening in Japan, Hong Kong, Australia, South Korea can equally happen in Singapore. And I think this is the mindset that all of us have to get used to. We still need to stay cautious, and we need to be conditioned that there may be some closures that may happen even in Singapore. And preferably, we hope that this will be sector-based closures.
Let's look outwards a little bit. Singapore and Malaysia are set to open a green lane for long-term pass holders and essential travellers next month. Will this lead to more imported cases and also a new wave of infections?
So I certainly hope that it will not, because if we put in place the right measurements, the safe precautionary measurements, such as the ones that we currently have with China, requiring pre-travel testing, on-arrival testing, some degree of reporting and sticking to a specific itinerary, requiring people who are coming into Singapore to download Trace Together or to have a Trace Together token. I think these are important measures that will minimize as much as possible the risk of importations.
The race is certainly on to find a vaccine. US firm Moderna announced that it will soon begin the final stage of human trials. How significant is this exactly, and what does it mean for the waiting time for a COVID-19 vaccine?
So Moderna announced that its trial on 45 subjects successfully produced neutralizing antibodies on all 45 of them. And the neutralizing antibodies are the crucial building blocks to protect one against being infected by the coronavirus. So that's a piece of very good news. The second piece of good news is that we observe also this dose-response relationship, meaning people who receive a higher dose of the trial vaccine actually did produce a higher level of neutralizing antibodies. So those are two pieces of good news, and I can see from the stock markets that it was equally reflected with some very positive gains there. So while there is some good news today that we should definitely cheer about, realistically, there are still many steps ahead before people like you and me can get hold of a safe, effective vaccines that allow us to return to life before COVID-19 and definitely to the holidays that we are looking forward to.
Well, thanks for your time as always, Prof. Teo. That was Professor Teo Yik Ying, who is the Dean at the Swee Hock School of Public Health at NUS.